Thanks for coming out. I hope you're all doing well. It's been a busy day. I was over at the school for a while today and got a good workout in, just filming a bunch of little kid stuff. So that was a good time. Today we have a couple of things on the agenda. First, I want to give you the opportunity to ask any questions if you have any from Monday. The video from Monday's class is posted up there under Monday, so you can go there and shore up any questions you have. Second, tomorrow we're going to have our quiz. It's nothing I want you to be intimidated by, certainly. I think I will post that at about 8 o'clock in the morning, and you'll have all the way till Sunday to take it. So if you take the quiz and you don't like your grade, you can retake it. The only thing I ask that you do is you take it by yourself. So, it might be, you might be enticed to share answers, but I'd just ask you, of course, not to do that. Just take the test yourself, and then if you don't get the answers right, you can just go back and fix it. But I want you to learn from it rather than kind of just shove answers down. So anyway, any questions there? All right. Great. Well, and if you do have anything, just shout out, because I'm going to be sharing my screen and I don't see the hand thing all the time. So that'll be great. So today we want to shift gears. On Monday, we talked about structure of the muscle and what the muscle looks like, in terms of the nesting doll sequence of just tube inside tube inside tube. So today we want to talk about kind of where we intersect with that in injuries and injury treatment, injury prevention, and have a better understanding. So when you're doing your own work or when you're coaching other people, you can kind of give them some good information and help yourself too. All right. So I'm going to present a little slideshow on the right one. There we go. With you. And so, first we want to talk about what muscle injuries really are. And we hear all kinds of terms for them. So we hear muscle strain, muscle pull, a torn muscle, all those terms. And sometimes they help us understand better what the injury is. Sometimes they don't. And sometimes they're really inaccurate. So the first thing is we want to talk about how we hurt our muscles. And the truth is doing basically anything. So we can hurt our muscles standing up, or we can hurt our muscles doing some gladiator thing, like some amazing thing. So the terms muscle strain, muscle pull, or muscle tear refer to damage to any muscle or its attaching tendons. So those things that connect muscle to muscle, muscle to bone. So you can put too much pressure on a muscle, or you can overstretch a muscle in a movement, and that can cause injury. So heavy lifting, playing a sport, doing a task for work or school, anything can cause a muscle injury. So muscle strain, muscle pull, muscle tear, they're just kind of describers of basically the same type of injury. Okay, so we have some gross pictures here. The one in the top left is how we hurt our muscles. That's the grade. So grade 1 would be, for instance, some muscle fibers, some muscle cells are torn, okay? But the muscle itself stays intact, so it might get a little swollen. Grade 2 is a partial muscle tear, so a more serious injury, and the muscle starts to come apart. And grade 3 would be a complete muscle tear, and that is a big deal. No matter small muscle, big muscle, that is a pretty big deal. So most of our muscle pulls and strains happen in grade 1, grade 2 level. and they can repair. Now, I want you to go down to the bottom and bottom leftish image there, and you can see pre-injury, a healthy muscle, and then when the injury happens, how the fibers and associated basically tubes get pulled. And if you remember the fascicles there that carry the blood vessels, they're kind of the stuff in between the muscle fibers. Those fascicles, when they get torn, it's not just blood vessels, but it's also nerves. So there's some really sharp pain that happens when a muscle is torn or pulled or anything like that. And then you notice in the healed section, there's a lot of scar tissue. That white fibrous material there is scar tissue that kind of helps to re-tube the whole area with blood vessels and reattach nerves and everything like that. So that's what we're looking at when we look at kind of the microscopic level of the muscle injury. Okay, up in the top center, that's an example of a real common area people hurt their backs. Can be back strain or back pull. Really, really difficult to deal with because those muscles in the back are usually large muscles that stretch spans of your back. So you can have pain going all the way from one spot in your back all the way across to another. So if you've ever had that, you know what I'm talking about. And then the picture in the right is actually a groin pull, and that is a picture of swelling. And lots of times we think of like, being hit and bruising, but we also get a lot of swelling and bruising essentially from muscle injuries. Lots of times people wonder how why is their arm swollen? They weren't playing in a contact sport, but their arm really hurts and it's swollen. And lots of times what's happened is they've pulled a muscle, and that muscle has naturally, when it tore apart, bled into the space around it. And that's what causes the bruising. So all these are kind of pictures that help you understand what's going on when we do pull, tear, strain a muscle. Okay, so this is kind of where we were. Swelling, bruisedness, redness due to the injury. We know that we've pulled a muscle if we have pain when we're resting. So pain at the muscle site or the joint associated with it. So pain when that muscle is used. So here I have pulled my bicep, it looks like, and just lifting my arm is too much. We have weakness of the muscle or tendon. So sometimes you can use an injured muscle, but it just doesn't have the output that it normally would. If you notice that, that's sometimes a indication of a pulled muscle. Sometimes there isn't too much associated pain with it. It's just a weak muscle. That can happen as well. And then inability to use the muscle at all. So if the muscle is completely not functional, we know we've done something to it and it may need attention. So when do we call a doctor? When do we need more than just home help? Then we want to think about a significant muscle injury if no relief comes after one full day. So more immediate calls would be if you do hear a pop with the injury. If you can't walk, obviously someone who's not ambulatory needs to go see a doctor. If there's big swelling, big pain, fever, open cuts, you need to go ahead and see a doctor, right? The doctor may declare you okay, or the doctor may say, no, you need to do some things. All right, so how about at home? What if that 24-hour period is going on? What do we need to do for muscle injuries when we're at home? Well, the first thing we want to think about is swelling. So we want to stop any swelling that has not occurred and abate any swelling that has occurred. And so we know that when we heat up muscles, whether through activity or artificially heating them with a heating pad, that increases blood flow to the muscle. So if you just hurt yourself, you don't want to put heat right on that muscle because that's just going to encourage blood flow to the injured area cause it to swell more. So heat is not a good thing when you've just hurt your muscle, right? Ice, though, is always good. So you want to pack it with ice, and the suggestions that they have 20 minutes per hour for as long as you can do it, like the whole day. And things like frozen bags of vegetables, ice in a foam coffee cup, things like that. You just want to put ice on, but not put it directly onto your skin because that can damage your skin. So put it on like a little paper towel or a cloth or something and let it rest on the muscle. When you have hurt a muscle, the first time you put ice on it, if you can, it's a good idea to ice it in the stretched position. So like if your calf muscle down on your lower leg has an injury, you're going to want to ice it, but point your toe up toward the ceiling. Don't let your toe push away from your body, pull it back up toward your body. That way that the cold can get into the affected area a lot easier. After that, you just ice it without worrying about where your toe is. Okay, so ice is good. Heat is not good immediately. If heat makes you feel better later, you can put some heat on it, but ice is always good. It reduces that swelling, it cuts down the swelling. So medicine options. Medicines, typically at home, over-the-counter medicines that people use for this type of injury, ibuprofen is most recommended. The reason why is because ibuprofen is called an NSAID. It's a non-steroid, basically inflammatory reducer. So that is a medicine that takes away swelling and pain. It knocks pain out. The danger with ibuprofen is some people with certain kidney diseases or people who are on blood thinners, and there's some other disorders, honestly, I don't know. They should not be taking Advil or ibuprofen because it can interfere with their previous condition. Acetaminophen is like Tylenol, and acetaminophen reduces pain, but it does not do anything for swelling. So it has fewer side effects usually for people, but it's not going to address the swelling. So if you're taking Tylenol, you really need to be pushing the ice, okay? Now, self-care at home, another little acronym to remember is PRICE. PRICE. The P stands for protection. You want to protect the area that's been pulled, and you don't want to have any more trauma to it. So the point of protection is either rest, like staying out of an activity, not using it, or if you have to be in an activity, being sure that it's not going to get knocked in more pain. Rest. Rest is very important. Rest until better. So staying off of that muscle in any kind of exertion is a good idea. Ice, all the time ice is recommended. Compression, we don't want to go overboard with compression, especially with muscle injuries. Compression is like maybe wrapping a bandage loosely around the area, not like a boa constrictor. So compression can help with some swelling, but if you tighten down too hard, that can actually trap swelling and cause a worse condition. So we don't want to kind of siphon all blood flow to the area. We want to wrap it loosely if compression is going to make you feel better. And then the E stands for elevation. And elevation is just keeping whatever body part is injured up on the level of your heart or higher. So elevating it, and that just allows any inflammation, blood that's flocked to that area to come back into your body system and circulate around without it clumping up and getting more and more swollen. Okay. So, what might your doctor say? You go to the doctor and you're Bugs Bunny and you say, "What's up, doc?" And the doctor says, "Well, we're going to look at this." Sometimes doctors will say, "You need a brace or you need crutches," and sometimes they won't. They'll look at it and they'll say, "No, you just need to rest it." And that's the truth. They know what they're talking about. The doctor may give some sort of activity, work, school, or team restriction. So particularly if you're at a job, you may need a note saying, this person can't do their job. Something else, they need to do something else in the meantime. That's going to be important, particularly if you're in a work environment. School, you can always take a break. Rehabilitation exercises or physical therapy. So for the more extreme injuries to muscles or any other body part for that matter, a doctor may recommend physical therapy with a physical therapist, or exercises to do on your own to kind of bring yourself back. It does happen sometimes with some muscle tears where a doctor will need to operate. That would be for a real complete grade 3 tear or something like that. Okay, so prevention. So we've talked about the injury itself, what to do when you're hurt, what medicines are available, the price method. But the prevention side is the part that's going to be long-term, saving you a lot of pain over time. So we want to help avoid injury by stretching every day. Stretching daily can be a pretty quick routine, or it can be more involved. But what fits your lifestyle, any stretching you can do is better than not doing any at all. So starting an exercise program, which all of you hopefully are on your exercise programs, but starting an exercise program says here in consultation with your doctor. That's if you're doing something that's outside of your ability level there. But starting an exercise program is important in keeping your muscles moving. Stretching after you exercise is really important. And establishing warm-up routine. So the warm-up routine needs to be getting blood into your muscles so that your muscles can appropriately function without being pulling on all their resources. Okay, so that's the prevention side. Now I'm going to stop sharing. And I want to come back. That's a lot of information pretty quickly. Any questions, thoughts, comments, experiences that you all have that could help us here? So the nice thing about teens and 20s is these muscle injuries typically heal much quicker. Little kids, they really heal quick. But the older people get, the more time is required to heal their muscle injuries and the associated tendon injuries. So things that heal quickly in a 5-year-old might take weeks or even months for an older person. So that's something we keep in mind. And you notice that in professional athletes, a lot of times you'll see a professional athlete who's maybe 22, 23 years old, and they'll come back from an injury after a week, where their 35-year-old counterpart doesn't come back for a month. So it can be kind of unfair that way for the old people. All right. Okay. Any question before we pull away here? Great. So tomorrow I'll put your quiz up, and I will do that in the morning. We'll have plenty of time to do it. I'm going to put this slideshow, these notes, available to you, as well as the video for this class. And if you have any question, don't hesitate. I'll be on my computer all day tomorrow, so don't hesitate to shoot a question my way. Happy to help. And take the quiz by yourself and do your best, and then just knock it out from there. Correct anything you need to correct, resubmit it. Okay. All right. Well, with that, I will see you guys on Monday in a Google Meet. Monday Google Meet. Tomorrow no Meet, unless you request one, but I think we'll be good. And Monday we'll reconvene. Thanks so much. I hope you guys have a great day.